Hello, my name is Isabella Holmes.
And I'm Sarah Farron, and we are the co-chief residents for the academic year 2025-2026.
We're so excited to share more about our program and show you some of our beautiful spaces in this video. We hope you enjoy.
Our program has 28 residents, and we offer multiple training tracks, including combined anatomic pathology and clinical pathology, anatomic pathology only, clinical pathology only, combined anatomic and neuropathology, as well as physician scientist training program tracks.
Hi, my name is Andrew Valisano. I'm a pathology resident here at the University of Michigan, and today I'm going to show you around our resident workroom here at NCRC. Currently, I'm in our education suite located here in the NCRC. This space has a lot of great natural lighting with views of the nature surrounding the building. The space is overall divided into two areas. First, the resident space behind me, and then the fellow space a little bit further across the way. Each resident here has their own desk equipped with a dual monitor setup and a docking station for the laptop that the department provides for you. This is really useful to have when you're working with multiple applications during case previewing, research, and other aspects of the day-to-day work. Additionally, each desk comes with its own microscope that's just for you that you can set up exactly how you like. All of the desks also include a small rollout shelving unit, and there are other shelves and bins all across the resident room for storage of books, research materials, and other personal items. We have a shared resident library with books to use among the residents and fellows that you can use if you're on a particular rotation and need to look at a book for reference. We also have a couple of dual-headed scopes in that same resident library that you can use to view slides together with another resident. In addition, we have another room in the resident space that has a 5-headed, multi-headed scope with large monitors that's great for sharing cases among multiple people. What I love about the resident space is that it's a very collaborative area with all your residents there in the same room and the fellows just across the way. It's really easy to reach out to somebody else if you have a question. Just outside the resident workroom is an area to get food that we lovingly call the gas station. It has small snacks and drinks that's really convenient just to pop over if you want something in the middle of the day. We also have a cafeteria that's shared among the entire NCRC that's just a 5-minute walk away that has more options for lunch and food throughout the day. Additionally, in our resident workroom, we have a shared kitchenette space that has a fridge and freezer, a really nice espresso and coffee machine, and shared space for preparing food.
So I think that one of the great assets of our program is the really strong expertise that we have in nearly all areas of AP and CP. And we really look forward to and pride ourselves on getting to know all of our residents and their individual interests and career goals so that we can work to match the strong resources in our department to help you achieve them.
We have 9 individual sign-out rooms for each of our main subspecialties. In the morning, the main rooms are utilized by residents on service to work alongside attendings and review cases that they have previewed the day before. Within the sign-out rooms, there are large screens which we can use to view pathology reports and virtual slides. We also have multi-headed scopes for use by residents, fellows, and medical students. Right by the sign-out rooms, we have a big rig, which is a multi-headed scope that we use for unknown conferences, consensus, and other meetings. Just through the doors of the sign-out rooms, we are able to access lab spaces, gross room, slide library, and more. We are now in the gross room located in the NCRC. As previously mentioned, the gross room is located by the sign-out area. And the gross room is where we perform our examination of specimens, meaning that we look for macroscopic evidence of pathologic disease. We have 14 stations that have all the necessary equipment to perform our examination. We also have a centralized area that is used for specific teaching conferences, such as neuroconference and medical student sessions. Additionally, we have special equipment in the gross room that helps us even further. We have a faxitron machine, which is a special X-ray that helps us identify metallic clips or calcifications in breast specimens. We also have an exact pathology bone saw to help us safely cut through bone when needed. As you can see, the NCRC gross room has all of the resources you could want when you're doing your gross examination of specimens.
Hi, my name is Orlando Quincoses. I'm a resident here at Michigan Medicine, and I'm excited to show you around our resident room here at the University Hospital.
Just like we have a resident room at NCRC, we also have a dedicated space here at UH. The room is conveniently located just down the hall from the other pathology areas. In this room, we have comfortable desk spaces that residents can use while on rotation at the hospital. There is also a kitchenette where we can warm up food and grab coffee or snacks. Another great benefit of this room is the 2 private areas available for any meetings we may need to hold while at the hospital.
To support resident training, our department has a high volume of cases both on the anatomic and clinical pathology sides of training, including both our in-house Michigan medicine cases as well as a robust consult network as well.
I'm going to talk to you today about the blood bank and transfusion medicine rotation. This is one of the few rotations that we have here at the main hospital because we need to be close to our patients. Right up front, we have our techs who handle day-to-day tasks to ensure everything runs smoothly. In the back of the blood bank, we have our reference laboratory where we work up routine and often complex antibody typing for our patients. Through the back doors of the blood bank, you will find our cell therapy support staff. Near cell therapy is also where our residents will sit along with 2 attendings. This is an amazing setup because we are all very close and can easily communicate about our patient needs without having to walk throughout the hospital. Additionally, this office space is also connected to our apheresis procedure unit where we see our patients for plasmapheresis, red blood cell exchange, and cell collection. During the day, we field questions from clinicians, work up transfusion reactions, and assist with apheresis as well as platelet refractory consults. We also approve blood products when necessary.
Our goal is to develop pathologists who are not only leaders in their field, but also innovators and leaders nationally in the ever-changing landscape of healthcare.
University Hospital is home to the state-of-the-art clinical core laboratory, combining chemistry, toxicology, biochemical genetics, hematology, and coagulation. Dedicated on-site faculty, knowledgeable laboratory staff, high test volume, and an expansive patient population make the core lab an exceptionally rich learning environment.
Hi, I'm Meredith Herman. I'm a pathology resident here at the University of Michigan. I'll be talking to you about the frozen section rotation. Our department sees a large amount of surgical specimens in-house. Because of the volume of cases we see, we have multiple frozen labs located in the new pavilion, Mott, and the University Hospital. Each frozen lab is equipped with multiple grossing stations. At Mott, we exclusively see pediatric and obstetric cases. When a specimen comes through the frozen lab door, it is logged and brought to a grossing station to be examined by a resident. After it is examined, it is frozen, cut on the cryostat, and then the slides are taken to the stainer. Once stained, they are brought to the reading room where they are looked at by the attending, fellow, and resident. Here, the diagnosis is made. Here on the Setup Pathology service, residents have the opportunity to partake in the rapid on-site evaluations, where we take a cart like this and we will go down to the operating room in the cancer center and perform fine needle aspirations and conduct cytopathology examination of the cells to determine next steps for the patient care.
Hi, I'm Nicole. I'm one of the pathology residents at the University of Michigan, and I'm going to show you around our autopsy suite. The unique thing about the University of Michigan morgue is not only do we serve the hospital system, but we are also the morgue for Washtenaw County. Our team consists of medical examiners, forensic fellow, residents, autopsy assistants, the medical investigators, and the biomedical photographers. An example of cases that we perform include hospital, adult, pediatric, fetopsy cases, as well as the medical examiner and forensic cases. Due to the number and diversity of cases that we see, it is very easy for residents to obtain their 30 required autopsies. As you can see, the autopsy suite contains a total of 4 stations. 1 is in isolation, but in general, 3 autopsies can happen at the same time. We have state-of-the-art equipment at each of the stations that allows us to perform full or limited autopsies with the help and direction of our medical examiner and autopsy assistants. We have a negative pressure room where we perform autopsies on high-risk patients with infectious disease etiologies. In the back of the autopsy suite, there's a cooler. This is where the decedents are kept until they're released to the funeral homes. Being a resident on autopsy and forensics service is a really unique experience. No 2 days are exactly alike. There's always something new to discover and something to learn.
Hey, my name is Chris Henderson, and I'm a second-year resident in the University of Michigan Pathology Physician Scientist Training Program. Here at the University of Michigan, PSTP trainees have top-notch clinical training, access to fantastic research environments, and personalized training plans to ensure our success. We receive rigorous clinical training and mentorship in biomedical research through the support of our outstanding faculty pathologists and research mentors. Each PSTP trainee will work with a mentorship committee to establish an individualized clinical training plan and identify a suitable laboratory and mentor for their research. If desired, clinical fellowship and training aligned with the trainee's academic goals will be supported. Research mentors may be a faculty member in the Department of Pathology, or with approval, another department at the University of Michigan. During their clinical training period, it is expected that PSTP trainees will use 6 months of research elective time, which can be credited towards ABP eligibility to work with a research mentor and transition into the laboratory full-time. Through the support of our faculty in the Department of Pathology, PSTP trainees can establish themselves as successful, independent, funded investigators, as well as excellent pathologists.
We invite you to stay connected with us by following us on our social media channels and also by looking at our website for updates about our residency program and beyond.
As you can see, we have a very well-rounded program with lots of resources, amazing training facilities, and wonderful faculty. We hope you'll join us for the next stages of your training, and don't hesitate to reach out if you have any questions.